Hello everyone. So today we are the group 10 and we will be discussing about seizure disorders. So the members are Abalo, Jimeno, and Paraguya. So this is Krisha Abalo and I will be reporting the first part of this report. So the objectives are the etiology, prevalence and incidence, signs and symptoms, pathomechanics, types, course and prognosis, management, existing support system in the country, and we will be also describing what speech, language, hearing, and or swallowing problems that involves in seizure disorders. So let's start. So what is a seizure? A seizure is an abnormal electrical discharge that occurs in your brain. So usually, brain cells or neurons flow in an organized fashion along the surface of your brain. So a seizure occurs when there is an excess of electrical activity. So with that, what is seizure disorder? So a seizure disorder is when a person is diagnosed with an epilepsy or a seizure disorder once he or she had two or more unprovoked seizures. So there are two kinds of seizures, unprovoked and provoked. So let's go first with the unprovoked. So what is unprovoked seizures? So unprovoked seizures have what are considered natural causes such as genetic factors or metabolic imbalances in your body. So however, on the provoked seizures, these are triggered by a specific event like a brain injury or a stroke. So what are the causes of seizure disorders? So the etiology, epilepsy has no identifiable cause in about half of the people with that certain kind of condition. So in the other half, the condition may be traced to various factors. So these includes genetic influence, head trauma, brain conditions, infectious diseases, prenatal injury, and developmental disorders. So as for genetic influence, some types of epilepsy, which are categorized by the type of seizure you experience or the part of the brain that is affected, run in families. So genetic kasi, di ba? Next is head trauma. So head trauma as a result of a car accident or other traumatic injury that can cause epilepsy. So next is the brain conditions. Brain conditions that cause damage to the brain, of course, such as brain tumors or stroke can cause epilepsy. So stroke is a leading cause of epilepsy in adults older than age 35. In infectious diseases, such as meningitis, AIDS, and viral encephalitis can cause epilepsy. For prenatal injury before birth, babies are sensitive to brain damage that could be caused by several factors, such as an infection in the mother, poor nutrition, or oxygen deficiencies. So this brain damage can result in epilepsy or cerebral palsy. And lastly, for developmental disorders, epilepsy can sometimes be associated with developmental disorders such as autism and neurofibromatosis. Aside from the etiology, there are also risk factors that may increase your risk of epilepsy. So these are the age. The onset of epilepsy is most common in children and older adults, but the condition can occur at any age. As for the stroke and other vascular diseases, stroke and other blood vessel diseases can lead to brain damage that may trigger epilepsy. So you can take a number of steps to reduce your risk of these diseases, which includes limiting your intake of alcohol and avoiding cigarettes, eating a healthy diet, and exercising regularly. As for dementia can increase the risk of epilepsy in older adults. So for seizures in childhood, high fevers in childhood can sometimes be associated with seizures. So children who have seizures due to high fevers generally won't develop epilepsy. The risk of epilepsy increases if a child has a long seizure, another nervous system condition, or a family history of epilepsy. So for the prevalence and incidence, active, as what you can see here in the pie chart, active epilepsy is 8.4 out of 1,000 people. So on the right side, had epilepsy at some point in their life, people 16.5 per 1,000 people. So epilepsy continues to be one of the leading causes of neurological consultations and admissions in the Philippines. And with a population of 83 million and an estimated prevalence of 0.9%, there is an estimated 750,000 people with epilepsy in the country, and a majority in the productive years of their life. Next. So, there are signs and symptoms for seizure disorders. So, one may experience short attention blackouts, dazed behavior, memory gaps, mumbling, or no response at all. So seizure disorders may happen when there are sudden falls, frequent stumbling, or unusual clumsiness, repeated unusual movements such as head nodding or rapid blinking, sudden stomach pain followed by confusion and sleepiness, unusual sleepiness and irritability when woken up, frequent complaints that things look, sound, taste, smell, or feel funny, sudden repeated fear or anger, clusters of repeated jackknife movements by babies who are sitting down, clusters of grabbing movements with both arms in babies lying on their backs. So these signs and symptoms given may vary depending on the type of seizures, which will be discussed by Donna. So in most cases, a person with epilepsy will tend to have the same type of seizure each time. So the symptoms will be similar from episode to episode. Next is the pathomechanics. So seizures are paroxysmal manifestations of the electrical properties of the cerebral cortex. So a seizure results when a sudden imbalance occurs when the excitatory and inhibitory forces within the network of cortical neurons in favor of a sudden onset net excitation.
Hi, I'm Donna Belby Paraguya, and I'm going to talk about the types, scores, prognosis, and management for seizures. So first, we have the generalized seizures. So generalized seizures occurs when the abnormal electrical activity causing a seizure begins in both halves or hemispheres of the brain at the same time. So basically, it just affects both sides of the brain. So under generalized structure seizures, we have these types. So the first one is the absent seizures. It causes children to stop, stare, and be unresponsive for a few seconds. So this type of seizure may occur several times throughout the day, and usually the child is not aware that a seizure had happened. So this is most common between the ages 4 and 12. The next is the atypical absent seizures. It is often associated with other features such as loss of muscle tone of the head, trunk or limbs, and subtle myoclonic jerks. So compared to absent seizures, this type has less abrupt onset and offset of a loss of awareness. Moving on, the myoclonic seizures results in brief jerking movements that can affect the whole body or just a single limb. Movements may either be subtle or very pronounced. So this type of seizure can occur several times a day. Next is the tonic seizure. It is a sudden rigidity of muscles, either extended or flexed. The muscles initially stiffen and followed by the loss of consciousness. So in this type of seizure, expiration is impaired as the muscles of respiration are contracted. Cyanosis occurs, and the patient may produce gurgling sounds. So cyanosis is usually caused by low oxygen levels in the red blood cells or problems getting oxygenated blood to your body. Next is the clonic seizures. It is characterized by repeated jerking movements of the arms and legs on one or both sides of the body. The next is the atonic seizures. It causes children to suddenly lose muscle tone, go limp, and fall to the ground. So this type of seizure usually lasts for only a few seconds. The child will typically regain consciousness and alertness immediately after following the seizure. Next is the tonic-clonic seizures, so also known as the grand mal seizures. It involves both tonic, stiffening, and clonic, which is twitching or jerking, phases of muscle activity. Tonic-clonic seizures may start with a simple partial seizure or aura. So the person may experience changes in sensation, mood, or emotion leading up to the tonic-clonic seizure. So these types of seizures usually lasts 1 to 3 minutes and take longer for a person to recover. So next type is the partial seizures, also known as focal seizures. So this originates on one side of the brain only. So the symptoms vary greatly depending on which part of the brain is affected, and it is divided into 3 categories. First is the simple partial seizures. So it normally lasts for less than 1 minute, and the child remains alert and is aware that they are having a seizure at the time, and they can remember it after. Next is the complex partial seizures. It normally lasts for less than 3 minutes, and the child is not aware that he or she is having a seizure. And then the child does not remember it after. Last is the secondarily generalized structures. So this starts from one side of the brain, but then the electrical disturbance spreads across the whole brain, thus resulting in a generalized tonic-clonic seizure or the grand mal seizure. Next type is the infantile spasms. So this is a less common type of seizure. It usually starts when babies are between 4 to 8 months. So it is a sudden stiffening of the body and brief bending forward or backward of the arms, legs, and head. So this kind of seizure, infantile spasm, is a complex and rare disorder that can have very serious consequences. It can lead to the death in some babies, and for some, it can cause intellectual disabilities and developmental problems. Even though once the seizure is gone, the damaging brain effects can still remain. Next is the neonatal seizures. So this type of seizure occurs in newborns. So they can be just subtle movements like pedaling or the movement of the legs, repetitive sucking or chewing, repetitive blinking, and fixed staring. Many babies with benign familial neonatal seizures develop normally, although some may have developmental delays that are seen in early childhood. So the next one is the febrile seizures. So it is usually a harmless event and usually associated with fever in children 6 months to 5 years old. So while febrile seizures may be very scary, again, they are harmless to the child. So febrile seizures do not cause brain damage, nervous system problems, paralysis, intellectual disability, or death. So the fever that triggers febrile seizures are usually caused by a viral infection and less commonly by a bacterial infection. Last is the photosensitive epilepsy. So these are seizures triggered by flashing lights or contrasting light and dark patterns. So as we have observed in some videos that contains flashing lights, they always put a trigger warning before the video starts. So this is to avoid seizures for patients with photosensitive epilepsy. Now moving on to the course and prognosis. So, seizures affect about 2% of adults at some point in their lives, and 2/3 of them will never have another. Seizure symptoms are most often diagnosed in early childhood or late adulthood. About 2/3 of all children with epilepsy outgrow their seizures by the time they are teenagers. However, it is still important for parents to help their child maintain a healthy lifestyle and ensure regular medical visits. Next is the prognosis. About half of children with symptomatic epilepsy that are seizure-free on treatment would appear to be seizure-free until the medication is discontinued. So it is important for the child to keep on taking medications to at least prevent seizures from happening. Also, a child should never stop taking medications unless it is recommended and closely supervised by a doctor. Next is epilepsy that begins in childhood often has a better prognosis than epilepsy that begins in adolescence or adulthood, although the evidence is mixed for children younger than 2 to 3 years old. Next is reduction in life expectancy can be up to 2 years for people with a diagnosis of idiopathic or cryptogenic epilepsy, which is a form of epilepsy with no known cause, while the reduction can be up to 10 years in people with symptomatic epilepsy. Symptomatic epilepsy is defined as epilepsy that follows an injury to the brain known to be capable of causing epilepsy. Next is children with congenital brain malformation, brain tumors, intellectual disability, or head injury are less likely to become seizure-free with or without medication. Next is, there is some research which suggests that underlying abnormalities can cause problems with learning and behavior. So, daytime seizures, for example, can affect learning by reducing alertness and by interfering with short-term information storage and abstraction. So, frequent and uncontrolled seizures impair learning new information due to the amount of time that the individual is unaware of the environment. Last is, epilepsy is not necessarily a lifelong disorder. Many people outgrow or have a long-term remission from seizures. Next is the management. So first is the medications. So not everybody who has one seizure will have another. Since a seizure may be an isolated occurrence, the doctor may wait until you've had more than one before starting treatment. That is why it is only be taken upon doctor's prescription. So specifically, we use anti-seizure drugs for treatment. So these drugs can stop seizures in 70% of patients with epilepsy, although they cannot heal epilepsy itself. And most patients will need to continue taking drugs to prevent seizures from happening. So here are some examples for the ASD or the anti-seizure drugs. We have carbamazepine, phenytoin, valproic acid, oxcarbazepine, and lamotrigine. Next is surgery. So epilepsy surgery may be an option when medications do not control seizures anymore. So this condition is medically known as refractory epilepsy or drug-resistant epilepsy. So the goal of an epilepsy surgery is to stop seizures or to limit their severity with or without the use of medication. So there are different types of surgery, and it depends on the location of the neurons that start the seizures, and also we need to take into consideration the age of the patient. Next is the dietary changes. So people with seizures or epilepsy are encouraged to have ketogenic diet, which is high in fat and low in carbohydrate. So it is usually used in children with seizures that do not respond to medications. So it has something to do with neurotransmitters in our brain. So the ketogenic diet reduces the amount of glutamate in the brain and enhances the synthesis of GABA, making it less likely for a seizure to occur. So the diet can also reduce inflammation of the brain and inflammation due to infections like meningitis, encephalitis, or autoimmune disorders that can trigger seizures. So if you're gonna ask if there are any specific food that can trigger seizures or that are not allowed to be eaten by patients with seizures or epilepsy, well, based from my research, there is currently no evidence that any type of food consistently triggers or sets off seizures in people with epilepsy. For the last one, the device. So there's a device called the vagus nerve stimulator. So this may help treat epilepsy if the patient does not get relief from medications. So it can also be used in children. So this vagus nerve stimulation device works by preventing seizures by sending regular mild pulses of electrical energy to the brain via the vagus nerve. So it is sometimes referred to as a pacemaker for the brain. So as you can see in the picture, there is an implanted device. So that is the stimulator. So it is implanted under the skin in the chest. And then a wire from the device is wound around the vagus nerve in the neck. So, based from the research, it is successful in preventing seizures, but it does not totally stop seizures from happening.
Hello everyone, I am Azalana Niwar Himino, and today I will be discussing the remaining parts of our report. So let's start with the management team. So first we have the pediatrician. This doctor specializes in treating children and is usually the first person we will ever see. Neurologist, a doctor who specializes in treating brain disorders, including epilepsy. Epileptologist, this is a neurologist who specializes in epilepsy treatment. Pediatric nurse, a nurse with special training in treating children. Nurse practitioner, a registered nurse with advanced training in treating many medical conditions. Neuropsychologist, a psychologist who specializes in neurobiological causes of brain disorders such as head injuries, central nervous system infections, and strokes. They will evaluate cognitive or learning issues that could affect how a child is doing at school. Clinical psychologist or psychiatrist, these specialists can help children with mood and learning disorders that are common in children with epilepsy. Dietitian, these specialists work hand in hand with an epileptologist in supervising the ketogenic diet of the patient. Occupational therapists, they can help find out why people have problems with tasks of daily living and teach them ways of adapting or compensating for the problems. Physical therapists, they can help people who have problems with moving and walking around. This may include helping people regain functional strength after a broken bone or a long period of not moving around. PTs can help people improve their balance, coordination, and learn safer ways of walking. And of course, last but not least, us, the speech language pathologists. Now let's move on to the medical precautions. So these are the warnings that we should keep in mind whenever we are put into a situation of encountering such condition. So there are actually a lot of medical precautions, but I will just be mentioning some. So first is we really have to keep calm. We cannot stop a seizure. So with this being said, we should not try to hold our patient during seizures or even stop their movements. Instead, we should stay with them until they are fully awake or fully okay. During therapy, we should keep our client in a room with padded floors. We should remove any objects that may harm the child. Also, we should avoid any sudden stimulus that may trigger an attack. Example of this one would be um, sudden noise, sudden loud noises, flashes, and many more. And lastly, for my report, inform the client's parents or caregivers about the attacks during sessions. So it is very important that we should keep the parents or guardians aware with what's going to be happening and what's going on and you know all that. Next is the Philippine seizure support system. First, here we have the play. the Philippine League Against Epilepsy. This association is dedicated to the enhancement of the quality of life of individuals with epilepsy through education, research, prevention, advocacy, and delivery of optimal health care. Next, we have the ESGC, the Epilepsy Support Group of Cebu. This is established by epileptic parents and adult epileptics to enhance the quality of life of affected families by offering moral support, epilepsy awareness, and increasing public understanding and acceptance of epilepsy. Here next is we have the sudden unexpected death in Epilepsy Institute. This institute works to reduce SUDEP and to provide help to people who have died as a result of SUDEP, or rather epilepsy-related deaths. So for the related problems caused by seizures, we have here for language. The extent and nature of language depends, rather, disturbance of epilepsy vary widely according to the type, severity, and cause of the said disorder. So for children, the language disruption manifests itself as a general decline in a broad range of verbally related abilities. This disruption will ultimately have an impact on reading and writing abilities. For adults with partial epilepsy, they tend to have difficulty understanding language, but these signs are almost always misdiagnosed. Rather than a language problem, most of these people are experiencing difficulties with understanding as a result of a problem in another field of cognition. The problem is often caused by a lack of focus or memory deficiency. Next here for hearing, myoclonic epilepsy is a rare hereditary seizure that can range from moderate to major, with grand mal seizures, hearing loss, mental damage, and heart problems. Next is swallowing. Epilepsy is a neurological disease marked by frequent seizures and is one of the most common neurologic disorders linked to dysphagia. So we all know what dysphagia is, swallowing difficulty, swallowing problem, something. So that's it. That ends our report. Thank you so much for listening, guys. Hope you enjoyed.